Graston Technique is an innovative procedure that detects and treats areas of scar tissue or adhesions in muscles, tendons, and ligaments that can lead to pain and dysfunction. In the healing process, our body attempts to repair muscles, tendons, and ligaments with scar tissue, much like the scar that forms on the skin when you've scraped or banged your knee. Scar tissue tends to be weaker and less flexible than normal, healthy, undamaged tissue. Scar tissue or adhesions prevent fluid movement of muscles, tendons, and ligaments, as well as the surrounding tissue. When someone says they feel tight or have pain with movement, they are experiencing the binding effects of scar tissue. Graston Technique uses 6 stainless steel instruments to glide along a patient's muscles, tendons, or ligaments. When knots or bands of scar tissue are encountered, both the doctor and the patient sense a restriction or granular feeling from the instrument. GT instruments are used to break up this restriction or adhesion. Stretching exercises are used to promote realignment of the fibers so they behave more like healthy tissue. The patient feels less pain and gains more mobility. Scar tissue limits range of motion and in many instances causes pain, which prevents the patient from functioning as he or she did before the injury. Normal tissue is generally dense, regular, elongated fibers running in the same direction as tendons and ligaments. When tissue is damaged, it will heal in a haphazard pattern, think a spider web, that results in a restricted range of motion and very often pain. The Graston Technique instruments are used to enhance the doctor's ability to detect adhesions, scar tissue, or restrictions in the affected areas. Skilled doctors and clinicians use the stainless steel instruments to comb over and catch on fibrotic tissue, which immediately identifies the areas of restriction. Once the tissue has been identified, the instruments are used to break up the scar tissue so it can be absorbed by the body. It's common to experience minor discomfort during the procedure and some bruising afterwards. This is a normal response and part of the healing process. Patients usually receive 2 treatments per week over 4 to 5 weeks. Most patients have a positive response by the 3rd to 4th treatment. Most patients are not disabled and continue to perform their regular functions at home or at work. Graston Technique has become standard protocol in universities and hospital-based outpatient facilities. The technique is also being used in industrial settings and by NBA, NHL, NFL, and Major League Baseball trainers. Historically, the Graston Technique has had positive outcomes in 75 to 90% of all conditions treated. It is equally effective in restoring function to acute and chronic injuries and pre- and post-surgical patients. Only clinicians who have been trained and accredited in the Graston Technique are qualified to obtain the Graston Technique instruments and apply the techniques to treat patients. Find out if Graston Technique is right for you.